Hello massage nerds. Today we're going to be doing a video on palpation and the art and skill of palpating. Palpating comes from the Latin word of palpare, which means nothing more than to touch. The objective of palpation is to assess the muscles and the locations. If you're going to do specific work, if you're treating a certain area and you want to know the difference between a tendon and the muscle or a bony landmark. Bony landmarks are nothing more than roadmaps to help you because that's where muscles attach. So it's good to learn your bony landmarks too. And there's superficial and deep palpation, and I'll show you right now the difference. And most palpation, you want to use your fingertips, your finger pads. And for bigger muscles, you might want to use the whole palm of your hand. And palpation is it lets you know if the muscles are tight, if they can move freely over one another. Sometimes the fascia is stuck and it offers resistance, so you'll be able to tell a lot about a muscle. Sometimes where muscles are dehydrated, they're a little bit more dense, or the tone of the muscle, or the adhesions from the fascia. So that's what we're doing, trying to assess when we're going to do assessment. And I recommend for the students to have the book out. You don't have to with your client, obviously, but make sure you let your client know what you're going to be doing, because it might feel strange to them when you start touching them and feeling, because it's different than the massage. So you want to make sure you let your client know that I'm going to be doing some assessment. I'm going to be touching some bony landmarks and muscle tissue. You want to go in slowly, not too fast, not too deep. You don't want to scare your client. So make sure that you feel first the tissue. Hopefully your hands are warm. You don't want to shock them too if your hands are not warm. And for the students, I tell them, have your book out. I use a trail guide to the body, which is fantastic. You want to learn the difference between tendon and muscles. Muscles usually feel a little bit more soft to the touch, and bony landmarks feel a little more harder to the touch. And I don't even have to use a lot of pressure. I'm just palpating. Like the acromion process is the highest part of the scapula. Like if you have a crow on your shoulder, acromion process is way up here. Here's the clavicle. You can see his clavicle very clearly. About an inch below the clavicle, about right here, is the coracoid process. And let's start with the deltoid. So the deltoid originates from the lateral third of the clavicle and then the spine of the scapula. So it goes around like here. These are the origins. And it inserts at the deltoid tuberosity. The deltoid tuberosity is on the humerus, and it's a bony landmark. That's a bony landmark where the deltoid inserts. Now remember that the deltoid is a multi-pennate muscle. So it's got the fibers going this way. Multi-pennate means that it's got like 3 tendinous attachments. Multi means more than 2. Bipennate would be 2. And multi-pennate means more than 2. So the deltoid right here, you can start palpating, for the deltoid, the anterior deltoid, the middle deltoid, the posterior deltoid. You want to feel. You also want to check for temperature, but I'll show that more on the leg, on the calf. See if the muscle moves easily. If it's not tight where it doesn't want to move, you can do a finger drag just with the 2 fingers here. Make sure it's not tight anywhere. Is the muscle moving? Does it feel healthy? And then you go to the deltoid tuberosity. Deltoid tuberosity is about halfway from your arm. So it's about right here. Most people, you can tell. I can tell it on him. And bony landmarks you don't have to put a lot of pressure because they do hurt, especially like right here in the coracoid process, where you have the short head of the biceps, the coracobrachialis, and the insertion of the pec minor. They all insert right here. 2 of them originate, 1 of them inserts. So you don't want to go too deep. You just want to palpate. So let's say I want to work, there's the brachialis and the biceps brachii are on top. So flex your arm for me. Sometimes you want to engage the muscle. Look at his biceps really pop up. So you can really tell the biceps. I'm working now on the bicep. You can do some lifting if you're working on the biceps, just to make sure you're on it. Now now the biceps brachii is for supination, like you're holding the soup. So you can feel the biceps when he's supinating. Now if he turns his fist down, the biceps disappears, and now you can get to the brachialis, which is underneath, below it. So you can palpate. I can palpate with both hands here next to each other. Okay, there's the brachialis right there. Now flex for me again, like, so I can tell where you, okay, right there. Right there is his biceps end right here. And I can feel right away where the biceps is, and when he turns his fist down, his bicep disappears, and now I'm on the brachialis. So that's how you can tell. Now there's a tendon attachment here from the biceps brachii on the radial side. Radial, this is your radius, and you can feel the tendon right here. Now be careful, because this is a dangerous site, but I want you to feel the difference between a tendon and a muscle. Muscle feels soft. Muscles feel soft. A tendon feels like a cord, like a rope. And that's the difference. That's what palpation is all about. Because let's say you want to work specifically on the deltoid, if they have problems raising their arm, or if they've had problems, even with the supraspinatus, which also assist for abduction. This is the reason why you want to isolate certain muscles, because you want to be able to treat the client. And if you need to engage the muscle in order to treat it, to find out if you're working specifically on it, if that's the muscle, that's when palpation comes, is very important, comes in handy. You can also palpate, on the ribs. Let me show something here. I want to make sure that his skin is moving, over the ribs. Make sure the intercostals or the pec, I'm on the pec major right now. Somebody that has had surgery, is the tissue moving one over the other, or is it really tight, where, like, if it was really tight and I could move it, that tells me a lot. So, you're able to tell a lot from how, or if you want to do a full palm palpation, you can also, go, I'm going to move the book here for a minute. You can do a full palm palpation here on the ribs. Is the rib cage moving? Is it flexible? Or do you feel tightness? Is it pulling anywhere? So you can tell a lot. You can do some skin rolling to see how the fascia is. You can do some skin rolling across the biceps, to lift the tissue, make sure that the fascia is not stuck. And like I said, you can engage the muscle to find out, make sure that you're on it by using the action of the muscle that way, like engaging. Like if I was going to work on his deltoid, then I would ask him to abduct your arm, like you're going to shampoo your hair, abduct your arm all the way up. Yeah, see, right there, I can feel his deltoid already. So you want to engage the muscles through their action to make sure you're on there. Also, something that is important is you don't need any lotion or oil when you're palpating, okay? You make sure your hands are clean. And another thing that I suggest to students is to try to close your eyes when you're palpating. Not with a client, but when you're in the classroom, try to close your eyes just to make sure that you feel the difference between a bony landmark and a soft muscle and a tendon, okay? So now we're gonna move on to the quads. Okay, so now we're going to do the quads and the tendons and some of the bony landmarks. So for example, here's the patella, which is a sesamoid bone. And this bone is embedded in the tendon of the quads. The quads tendon inserts right at the tibial tuberosity. So you want to feel the difference, feel the difference. What does it feel like? You can tell that you can use your whole palm for this one too if you want to feel what it feels like with your palm. Feels very bony. You don't have to use a lot of pressure. You can use just the finger pads, but this is the tibial tuberosity where the tendon from the quads inserts. Look at the book. All of this, it shows you where the muscle begins. So X, would you extend your, okay, right, perfect. Can you guys see where the muscles start? All of this here is tendon. All of these cross the knee and attach at the tibial tuberosity. So this is a bony landmark. Here's the side, and you can feel the difference, that this is a little harder, and then you can start palpating the muscle. It's softer. Okay, you can relax. So you can feel the difference. Let's go with a rectus femoris, which is a bipennate muscle. And what that means is that the fibers look like a feather and the tendon is right in the middle. So the fibers go like this, and this is important for when you work the muscle. And it originates, you palpate gently. You make sure you keep eye contact with your client, and so they don't feel uncomfortable. And you locate the anterior inferior iliac spine, which is approximately right here. I'm using 2 finger pads just to feel that. This is where the rectus femoris originates, which is also an insertion, but it originates here, crosses all the way down and inserts at the tibial tuberosity. Okay, then you have, let me see, extend, flexion. Okay, so right here you have your vastus medialis, vastus lateralis, and the vastus intermediate is in between the two. So you want to make sure and just palpate. Are you able to move the muscle? Is it tight? You're palpating with your full hand to see if the muscle moves freely. You can also lift to separate especially the rectus femoris. You want to separate some of those fibers, or are they tight? And that'll tell you, is there any trauma that maybe sometimes people hit the table corners and they can hit themselves here, and you can feel that the tissue feels a little stuck. That's what you're feeling for. Okay, look at the book and look at how the fibers go for the rectus femoris, and look at where the tendon is. This feels ropey to my fingertips. Then it starts softening up. Right there is where his muscle begins, approximately right there. Make sure that there's movement, that there's flexibility, that the muscles glide over one another. You can do some lifting. You can go with your finger pads, just all the way up. Make sure that it moves back and forth, that there's no adhesions. And when you get to the patella, remember this is more tendinous tissue, so there's not that much movement here. This is all tendon, and actually his patella is kind of stuck. It's very tight. This tendons are really holding that patella in place. I find more movement in other clients than on him. I should be able to move it back and forth a little bit. It's a little bit stuck, so maybe his tendon, I might want to work around the tendon a little bit, do some friction. And remember, look at his tibial tuberosity, very pronounced. You can really see it here. So this is tendinous tissue, and the reason it looks white in the books is because it has less blood flow, so they do take longer to heal. Muscle heals faster. There's more hemoglobin, there's more blood flow, more red blood cells. Tendon does not. That's why it looks white in the books. And with palpation, what I like is it looks so different when you're looking at a flat page than when you actually get the students on the table and palpate. So it's very different, and hopefully you carry this to palpate with your clients and let them know that you're going to be palpating, because you're trying to isolate certain muscles to work on them, especially when you're going to go do specific work. So this is it for the quads. We assess the quads, the bony landmarks, the tibial tuberosity, the tendon, and the muscle tissue. Now I'm going to show you on the calf. Now we're going to do the calf muscles, and this is a great area because there's a lot of things to palpate here. Remember, you're going to start with your fingertips, and I want to start with his foot to feel for a hard or end field. You know, is his foot flexible? When I'm flexing it, I'm doing, you know, it's a passive motion. I'm doing the flexing and extending. I'm moving the foot inverted and everted, and see how it, you know, how it's moving. If I feel anything getting stuck. Usually when people have had injuries on their ankles, I can feel like, ooh, it doesn't move that way, or it doesn't move laterally. This is your medial malleolus, and this is from the tibia bone. And your lateral malleolus is from the fibula. So these are bony landmarks, okay? These are very bony. So go gentle. You don't have to, you know, go hard. And here is your Achilles tendon, which is really calcaneal tendon. And if you can see in the book, your Achilles tendon is pretty large, pretty massive. Here's your calcaneal bone, and here's a tendon. It feels like a rope. It doesn't feel soft like the muscles. It feels like a rope, okay? So you can go across it, just gently follow it. See how far, where you feel some of the muscle begin. I can tell right here, it starts getting a little bit softer. Here's where the muscle's beginning, like right along here. So I'm feeling the muscle. Does it move? And I can use my full hand here. Does the muscle glide freely over the soleus? Or do I feel anything stuck? You know, and this is what palpation is. You're assessing the muscles, you're assessing the tendon tissue. You can go to the medial and lateral epicondyle of the femur, where the origin of the gastrocnemius is. Be careful here with the popliteal. Remember, this is a danger site, endangerment site, because you have blood vessels and you have nerves going through here. So you never want to press hard on the popliteal. But if you go about an inch higher, you can feel the tendinous attachment. It feels like you're rolling over a cord. That's the tendon. If you can see here in the book, all the white, that is tendon. So let's get down maybe a little bit lower here to the belly of the muscle. You can ask your client or your fellow student to point their toes, and it really shows the gastrocnemius right here. Look at how it pops up really nice. And once where it ends, once he relaxes, you can get to the soleus. The soleus is underneath that. You can do some lifting and separating. So you can lift, and if there was some tightness, if there were some adhesions from the fascia, you know, deeper, you might have to go a little bit deeper, palpating. But if not, you know, you can do some lifting. You can do some skin rolling. And like I said, for palpation, you do not use any lubrication. The oil and the lotion that is naturally on the body is enough, because you're just palpating. You're making an assessment. Remember that, you know, palpation is just to make an assessment on the muscle, so you can go back and say, okay, I need to work this muscle here and there. I need to work at the attachment size, at the insertion or the origin, or maybe the belly of the muscle if it's not moving. Let's say that, you know, this is really tight right here. Sometimes when people roll their ankle and have had, you know, ankle injuries, all of this fascia is like really tight. And that's a sign of, you know, of something, of a dysfunction going on. You can do some, I like this, like and you can also go with the pads of your hands. Just kind of feel, you're feeling. Remember, you can close your eyes and feel the difference between soft tissue, palpating soft tissue, and hard tissue. What does that feel like? What does a tendon feel like? What does a bone feel like? So palpation is about getting to know the body, and it's great when you practice in the classroom, so that when you get to your clients, you're not as awkward about it, you know, because it's different. It's different than massage. You're actually palpating, and sometimes clients, if they're not familiar with anybody doing that, make sure you explain to them what you're doing, let them know, and don't go in too fast, not too slow, you know, just, you know, with your finger pads mainly. And if you need to use for bigger muscles, if you need to use the palm of your hand, you can. We went over the deltoids, the biceps, the quads, and the calf, the gastrocnemius, and the soleus, and a lot of bony landmarks. Remember, they're just a roadmap. On the bony landmarks, I do remind you to go a lot lighter because they are more sensitive. So that's it, you guys. I hope this will help you, that you enjoyed it, that you share, that you like, and that you subscribe. I'm looking for new subscribers every day. We got to keep growing the channel, sharing the knowledge, and continue being massage nerds. Until the next time, create a great day.